Hey everyone, today I want to tell you about my experience during Health Practicum, which is a cool elective that I took this past year. Practicum is a double-blocked 5.0 weighted class where you can gain lots of shadowing experience in healthcare that can be useful for your future career in medicine. Firstly, I want to tell you about the journals that you write. So each day that you shadow, you submit a journal where you describe your day and define 5 new terms that you learned that day. You can do this journal in many different ways, but the way that I decided to write mine was by doing a brief description of each patient. So I wrote about their current condition, expected or current courses of treatment, and other anecdotes about the interaction with that patient. Next, I want to tell you a little bit about my experiences that I've had when shadowing and what types of doctors that I got to see. So this first semester, I shadowed at Texas Orthopedics, where on Tuesdays I shadowed a joint specialist, and Thursdays I shadowed an orthopedic trauma surgeon. During spring semester, I shadowed a reproductive endocrinologist and have also worked on my EMT training. When shadowing the joint specialist, I got to see lots of injections for arthritis, especially in the knee and hip. There were some that were guided under an ultrasound, so I got to go in the ultrasound room, see all the technology that was used, and I also got a preview for what the job of an ultrasound tech is. There were also a few patients that had unexplained pain, and the joint specialist doctor was able to provide them with answers and treatment for their pain. The first semester, I also shadowed an orthopedic trauma surgeon. This profession was cool because there was a wide variety of different types of fractures and patients that the doctor saw. Every case was unique, so you never knew what to expect. Because of the nature of the doctor that I shadowed being a doctor working in trauma, he sometimes received patients without insurance or that were not fluent in English. One cool thing that I got to do was translate for patients that only spoke Spanish because my doctor only spoke English. This is something that I did usually once a week and showed me the importance of being fluent in Spanish in healthcare, particularly in Texas. One of the most intriguing patients that I got to see had a gunshot wound, so not only did I get to see what that looked like, but also it on an x-ray, and also got to see the different courses of treatment to help him. During the spring semester, I shadowed a reproductive endocrinologist at Texas Fertility Center. During the shadowing experience, I got to see the complex process of IVF, or in vitro fertilization, and other assisted reproductive technologies such as IUI, or intrauterine insemination, and surrogacy. A majority of the time I spent shadowing was observing different types of ultrasounds throughout the IVF process. During these appointments, I also learned about the different types of medications used throughout the process. However, the most interesting thing that I saw while shadowing the reproductive endocrinologist were the surgical procedures in the operating room. I saw the egg retrieval process as well as the embryo transfer operation. It was super cool getting to be in the OR and seeing not only the surgical procedure but also the work of the anesthesiologists and surgical technicians. Although I only shadowed at the site for 2 months, I became very familiar with the different types of treatments that the reproductive endocrinologist did, as well as the procedures that he did. Shadowing at these sites not only showed me the day-to-day clinicals and operations that doctors do, but I also got to see the human side of healthcare. I saw how doctors interacted with patients and how to handle different situations, particularly with difficult patients. Gaining this real-world experience has been invaluable because I've learned a lot more about the ins and outs of the medical field. For the past 2 months, I've been working on completing my EMT certification during the Practicum class period. I will finish the online portion of learning and then will complete a skills lab and clinicals to become certified. I plan on working as an EMT in college, and this will give me much more hands-on experience in medicine. To conclude this video, I wanted to give some advice to future Practicum students who are taking the class next year. Firstly, I suggest visiting your site before you begin shadowing to become familiar with the location and the parking situation. This makes it much less stressful on the first day. Secondly, I recommend taking advantage of any connections in the medical field that you may have, as it can make finding a site much easier. Feel free to ask any family friends who are in medicine, as well as any of your own doctors, to see if you are able to shadow one of their partners. Thirdly, don't be picky when it comes to choosing a site, as shadowing any specialty will give you valuable experience in the healthcare fields. If you have any questions, ask Ms. Sumwell in room 101. Practicum is a really unique experience and opportunity for anyone interested in a career in STEM.